So I wanted to give a couple of different exercises you can do if you're dealing with a tight back. So it depends on where the tightness is, so we'll go over a couple of different areas today with that. Big thing is stretching a tight back is not always the best option, because what is causing the tightness is also potentially what is protecting you from further injury. So sometimes stretching does feel good to relieve it, but only to bring back symptoms a couple hours later, and so on. So one of the things I like to do is use breathing for a reset. So doing what we call 90-90 hip lift. What this is going to do is help to relax the lower back and turn off any overactive nervous system. So actually truly affecting the muscle to the nervous system. So you can use like a coffee table, a couch, whatever you got at home. Usually going to do about 5 to 6 breaths. You want to find a spot, hips at 90, knees at 90, head is relaxed. You will not want head coming up. So lower back wants to be flat against the ground. I want to dig my heels in. When I dig my heels in, I want to feel those hamstrings activated. And as I'm pushing in, my hips will come off the ground just ever so slightly, tilting those hips back to myself. I might feel a gentle stretch in the lower back from here. Big inhale, slow exhale. I want a soft belly. Inhale, slow, long exhale. I'm not speeding through this. It's a slow inhale, long exhale. Relaxing, and then I'll relax coming down. Going 5 to 6 breaths, I'll relax, going again, repeating for 2 to 3 sets of 6 breaths. Another thing you can do is use a foam roller, again, to turn off any overactive muscles, so not necessarily stretching. So what we'll work on, again, with the lower back, that is the hip flexor. So that's the muscle that comes from here to there. So you can get in there with a foam roller, like kind of rolling in that kind of saddle area, going back and forth a little bit, so rolling that hip flexor, even going a little bit off to the hip a little bit, can also be beneficial with the tight lower back. The other area you want to hit up is the lats. The lats attach from the shoulder all the way down to the lower back, so tight lats can actually pull on that lower back area. So similar, we're gonna go into like the armpit of your shoulder. So coming here, I'll keep my weight on the ground still. It doesn't take a lot of pressure, but it might be a little bit uncomfortable depending on how tight you are, but a nice roll back and forth. Again, with any rolling, I'm gonna go for about 20, 30 seconds each side, doing 2 or 3 sets of that. One of the stretches that can also be beneficial, again, not directly stretching the low back, because a lot of times this area isn't what's necessarily tight. What is tight is the hip flexor. So I want to try to get those hips to a more neutral position. So again, I can use a couch, I can use a coffee table, doing what we call the heel to butt stretch. So in this position, I'm gonna have one heel on the object, one knee down. You might want a pillow or something like that for that foot. Big thing, leg is straight, lower back. I don't want to be arched to get up. I want to bring those hips underneath. So I should get a deep stretch. I should feel that glute engaged a little bit. Get a nice stretch there. Again, I'm going to hold out 30 seconds for each side, going 2 to 3 times. Another stretch we might want to do once our lats have been rolled is doing what we call the child's pose. So there, we're going to sit our hips back to our heels. We're going to come long, not necessarily forcing the back flat, coming long, and then from there, lightly walking over. Nice inhale to fill up the rib cage to get a stretch in the lats. Exhale, coming back down. So those are a couple of foam rolling drills you can do. So breathing reset to help turn down the nervous system with the 90-90, using some of the foam rolling spots to again help turn off some of those muscles, bring blood flow to them. And then using a couple of precise stretches to get into that front side to change the position of your pelvis or the positioning of shoulders or pull from the back muscles down. So give that a try.